Hi, my name is Neil Singleton and I'm the Insurance Commissioner with the Motor Accident Insurance Commission here in Queensland. Today I'm proud to announce the winners of Bionics Challenge 2021, a unique Queensland-led competition designed to fast-track medical bionic innovations to change the lives of those living with serious injuries or loss of vital functions as a result of road trauma, complex disabilities and/or chronic disease. Within Bionics Challenge 2021, I'm also proud to announce the winning innovation in the category of Bionics, the brain, Neurotech and AI. This year's $50,000 major categories prize goes to Cortex Brainwave Technologies, co-founded by Casey Pfluger and Amy Rose Goody. Cortex is developing a new tunable near-infrared neurosensor and a new brain-computer interface therapy for the 1 in 5 Australians affected by acquired brain injury, learning disabilities, stroke, ADHD and autism.
Well, the winner of Bionics, the Brain, Neurotech and AI category is Casey Pfluger and Amy Rose Goody of Cortex Brainwave Technologies. And congratulations to you all, guys. Their project, Cortex Brainwave Technologies, Neurosensor and Brain-Computer Interface, and now we're going to go over to their video.
Hi, my name's Casey and I'm the founder of Cortex Technologies. I never saw myself as a startup founder. I was content as a university neuroscience researcher. But what changed everything, and the reason I founded Cortex, was the birth of my daughter. My daughter Ingrid has ADHD and autism, which has a significant effect on her everyday life. I see my daughter struggling every day in ways that I know inside and out, because you can't tell from looking at me, but I also have ADHD and autism myself. And I would do anything to help my daughter access the treatments she needs, even if it means I have to build it myself. Imagine dealing with brain fog, difficulty concentrating and coordinating, as well as skin sensitivities and difficulty in concentrating. That is what people with ADHD and autism, as well as brain injury, live with on a daily basis. The problem we are solving with Cortex is the access for people with disabilities to high-quality neurofeedback therapy, a form of treatment using biofeedback to improve brain function and quality of life. At Cortex, we are determined to help people with diagnosed brain conditions by building a high-quality brain-computer interface, BCI, neurofeedback therapy device. Neurofeedback is a clinically validated form of game-based biofeedback that optimises brain function using therapy games linked to brain activity in the user. Neurofeedback is validated by more than 20 years of clinical research data and is a recognised clinical treatment for ADHD. The current gold standard for neurofeedback is an EEG cap on the head with added electrolyte gel injected in place. Our solution is a near-infrared based sensor that is able to penetrate deep into human tissue, including the brain, to measure where nerves are active or inactive. The response time for EEG is slightly faster than for near-infrared, but EEG is unsuitable for home use due to the disruption that the high levels of electrical interference in the average home environment cause to EEG signals. EEG measures the surface of the brain, whereas near-infrared can access up to 8 centimetres into the brain. We can also tune our sensor to measure at different depths inside the brain. Movement is unsuitable for EEG, but not for near-infrared. The users of our device often find it difficult to stay still long enough for an accurate EEG reading. Our headset will be portable and wireless for ease of home use and to allow users to move. Unlike our competitors, our BCI sensor works through hair on all skin colours, is compatible with movement, lightweight and has a short setup time. Our novel optical interface significantly improves both signal quality and sensitivity. Our beachhead market is the near-infrared medical sensor market with an IP-protected product that is a saleable sensor. The near medical sensor market has a total available market of 113 million to 200 million, growing at a CAGR of 6.1 to 12%. Our BCI market pathway is B2B via established medical device distributors. In terms of commercialisation, the market will expand into gaming, remote monitoring, IoT, and performance improvement. Gaming and consumer electronics is an obvious future path to market. However, we understand that if we start with a non-medical device, it will be difficult to move into the medical device market, where we can see significant market scope and size and the ability to make a real impact in the lives of so many. Phase 1 sensor distribution will be B2B IP licensing, with Phase 2 in our BCI distribution being primarily B2B sales. We will build reimbursement around B2B distribution and non-exclusive licensing of our novel sensor intellectual property. We have been approached by 41 Medical, who are establishing 61 Medical, a medical device sister company in Australia. 41 Medical have an established track record in medical device development and registration, and we have a firm undertaking with 41 Medical to enter their established medical registration pathway for entry into the international market once our sensor tech is further along in the industrial design pathway. We will continue to consult with experts in the Applied Neuroscience Society of Australasia, the Queensland Brain Institute, University of Queensland Centre for Clinical Research, Griffith, QUT and USC in developing our device. Our Phase 1 neurosensor prototype provides proof of concept. It is generating high quality blood flow and oxygenation state data, and it's easy to set up and use. We are now seeking seed funding to move to Phase 2. Phase 2 entails refining our sensor software for brain measurement and building the Cortex BCI therapy headset, which utilises many individual Cortex neurosensors to track whole brain activity. We require $2 million to complete industrial design, manufacturing optimisation, and quality systems. And we will require $30 to $50 million to complete the regulatory approvals process. We will use the $50,000 from Bionics Queensland in sensor optimisation, industrial design and IP. Our sensor has uses in other bionics and medical devices. They need high quality sensor components for high quality data and output. Our team strengths are in medical research, BCI tech, research and development, business management, electronics, software and clinical neuroscience. We are working with commercial collaborators including Clandestine and Carbon Circuits to further develop and optimise our sensor. We have confirmed our collaboration with 61 and 41 Medical, which will begin in our next stage of sensor development. We also have strong connections with Partech Brisbane, who can provide us valuable resources as far as manufacturing optimisation. We are fortunate to have the opportunity to work with such an amazing group of advisors and collaborators. Thank you, and with your help, we will help people like my daughter to live lives less affected by their neurological conditions.
Casey and Amy Rose and team, heartfelt congratulations. It's so wonderful every time I see you present and talk about your project, Casey, and just what that means to you with your daughter as that motivation, and indeed yourself at times as well. You really wear your heart on your sleeve, and you've been a wonderful contributor to this whole project. Just tell us how you're feeling with picking up this award, and of course the substantial cash prize that'll help you get that IP and other steps taken.
We're still trying to adjust to the news. Wow, this is fantastic.
That's wonderful. And tell me, what's the first step you'll take? So money hits the bank. What are we doing? Where are we going? What are we going to see next?
We've already got everything lined up to move to our next stage prototype, where we no longer have our big wire sticking in to power everything. Everything becomes a wireless modular device, as well as starting to move into our design phase on the BCI headset. So, yeah, really exciting stuff.
Wonderful. Can we bring Amy Rose up? I think she was on the call as well, if we could spotlight both of you. Knowing it's always a team effort. If the team's there, lovely to have you both on the screen. How are you, Amy Rose? Welcome.
I'm amazing. I find it really unfair that I can't tell anyone right now.
Excellent.
That's the only thing I'm whinging about, but it is just an absolute pleasure. But a pleasure really to go forward with the Bionics Queensland Challenge from here onward. We're going to get like another amazing opportunity to accelerate what we're already doing. But I know the impact of the media and the social media and the opportunities that come from that alone. Without the money, that opportunity itself is going to be incredible for us. And alongside this cohort, so being among this brilliance is an absolute pleasure. And I'm so, so grateful to everyone at Bionics Queensland.
Wonderful. Robin?
Yes, and Amy Rose, you've obviously, yourself and Casey, you've got fantastic plans ahead for further design, the prototype work to still build. What are your aspirations for the next couple of months, like looking ahead over the coming months, for example, the rest of this year now as a result of the work you've done so far?
Well, Casey and I are excited about fine-tuning. So I'm really excited about fine-tuning the business side of things and getting all of our I's dotted and our T's crossed. Casey is also really determined to optimize the sensor and make it a little less ugly so that we can attract some further growth and some further investment, perhaps. I guess just make what we already have even better.
Yeah, absolutely. And I think the human impact of what you're aiming to do, I mean, in your particular case as a project, I guess among all of the entrants, you know, it really is people with families, busy grassroots innovators, like not lecturing in universities or even have had access to large-scale R&D grants. So you're really in a category here where this particular prize we know will be really, really beneficial to your next step, but also I think the mentoring as well. You've stayed, I think the one thing I can say, last year you did win an Early Bionics Innovation Award and you really stuck it out with Bionics Queensland, and we kind of had lots of mentoring with other expert advisors as well. I mean, Laura Falconer, for example, who's involved this year, she's certainly stayed the journey as well to see how you're travelling. So it's the big thing this year, I think, for startups in the competition is that we've got really an array of people that are interested specifically in startups that are already in place. And that includes, of course, Morgans and others that are FB Rice and others that are involved in the competition in the way of sponsorship this year. So I think certainly the IP, the legal, etc.
I would absolutely encourage anyone who's participated this year, and whether you get an early innovation prize or whether you get one of the major prizes or you don't get any of the prizes, there's still a massive amount of benefit you can have from the mentorship you can get from Bionics Queensland and the associated people around them, as well as the team members here. We are always available to help. If we can help you, we will help you. If we can connect you to people that we know that can help you in your project, we will help you. So reach out to us.
I think you've demonstrated that, Casey, well and truly. So really thank you for those many contributions along the way as well. It's been really valuable and greatly appreciated. And one thing I really have enjoyed when I've heard you, especially in the Q&A sessions and even at times when you've dealt with questions that you might have found challenging on the spot, you've dealt with it so professionally, but you've understood intimately the challenge of the people you're trying to satisfy or solve with an accurate sensor where they may not welcome the stimulus or the contact of other devices. And I think your depth of appreciation and empathy for the thing you're trying to solve for your target user is really wonderful. So really hoping that stands you in great stead for the next steps.
I think one of the things too with your project, the interest of neuroscientists of Queensland Brain Institute and others in seeing where you take the program, the therapy program, has been something that's come to light through the competition. There's the quality of the neurosensor and the development with that, but beyond that, it really is the quality, the outcomes of the therapy that you'll develop, and having inputs from QBI and others is going to be really beneficial. So that's really good. Looking forward to that.
So congratulations again, and enjoy putting that support to good use, and we can't wait to track you on the journey. Look forward to working with you through that.